Welcome, Dr. Amy Vinson, Assistant Professor of Anesthesiology at Boston Children's Hospital. She is the Chief Wellness Officer for her department and the ASA Physician Wellbeing Committee Chair. She represents the ASA to the American National Academy of Medicine Action Collaborative on Wellbeing. I'm so glad to have you here today. For those of us who may not know you very well, can you please give us a brief summary about yourself?
So my name's Amy Vinson. I am a pediatrician and an anesthesiologist. I work up in Boston. I'm originally from Georgia. The biggest thing about me is probably I love my family. I have a wonderful wife, beautiful son. He's 7 years old, and I have been studying well-being in its various aspects since around 2010 when I was in my second residency.
Thank you. Thank you for coming today and talking to us. So a little bit about how you became interested in physician well-being.
Yeah, I started getting interested in my second residency, as I mentioned. So I had done a pediatric residency, and pediatrics is very much a team sport. It's a very emotive field. It's one where you have to address aspects of psychosocial stuff, and so you tend to be a little bit more comfortable with those things in general. You also work together as a team a whole lot more. And so when I transitioned to anesthesia and I experienced my first adverse event as an anesthesia trainee, I was really struck by how incredibly isolating the experience was and how personally I took it. And I came to realize that anesthesiologists are really they do lead a very isolated work life, and B, I think because of a combination of our training and our personalities and sort of psychological makeup, um, some of which are tools that we use in the job, like a little bit of obsessive compulsiveness, a little bit of anxiety, we tend to take this really outsized responsibility for the outcomes of our cases. And so, isolation combined with that lead to situations where people really need a lot of peer support and aren't getting it. And so I became very interested in that in residency. I started studying that. I started a program at my residency. And then because, one thing leads to another and you run into some really good mentors along the way, I got plugged in with the ASA, started doing work with other aspects of well-being, and really quickly landed on sort of a bedrock of, our well-being is integral to the type of physician we are, to the type of clinician that we are. It's not just about doctors. And guarding that well-being is not just about our own personal resilience and, wellness, if you will, but it has a heck of a lot to do with the systems that we work in and how those things work to support us as human beings doing a very emotionally, spiritually, physically, cognitively intense job. And so I have looked at a number of aspects of well-being, from substance use disorder, peer support, organizational psychology, what have you, and have had the pleasure of really getting to know a lot of people in the field and hopefully helping foster a network of like-minded individuals through the work of the ASA.
That's so awesome. I didn't realize that you had been doing it for so long in well-being.
Long before it was cool, I actually remember, I was about 2 years into working on well-being when Tate Shanafeld's paper on burnout came out in 2012. And I remember distinctly seeing this paper. I'm like, oh my gosh, I can bring this to my chair and be like, see what I'm doing is not ridiculous. So yeah, it was at the time, it was very strange. And you'd have to do a lot of prefacing in your talks and like this. And now everybody, especially when you talk to trainees, they're like, oh yeah, I know all about this. You don't have to do all that groundwork to kind of grab your audience, if you will. Like, people are kind of, attuned to the fact that, yeah, this stuff actually does matter. It actually impacts people, and including our patients, our families, what have you.
Mm-hmm. And I like the fact that this comes up, another point I'd like to bring up is the fact that you're able to create a career path for yourself in an area that wouldn't normally have been considered a topic, and that you persisted in this topic. Now it's like a whole big field and a whole something that is really everyone is really looking into now. So I just would like to point that out because something that you think about may not be considered a topic right now, but in the future it will be. And so you just have to continue doing your work in that arena.
Yeah, I mean, I've been really blessed to have an area of interest that I'm passionate about, that I find truly interesting, truly fascinating. I mean, one thing about me that a lot of people know is that at one point I was considering going to seminary versus going to medical school. And so, the idea of caring for the people I'm around comes very naturally to me, and I find it very fascinating. Um, so it's been very easy for me to sort of sustain that passion in this field, and I've been very blessed to work at a place that has the flexibility and the resources to sort of allow me to explore this as my academic interest. And having a chair, for instance, who supported my promotion based on this work, which was really novel at the time, and took a lot of convincing on the part of the chair, quite frankly, to the promotions board.
Mm-hmm. Mm-hmm. Yeah, that's awesome. As you already mentioned, physician wellness has become a major issue in healthcare. What advice can you give to hospital and anesthesia leadership on improving physician wellness at the system level?
Yeah, I mean, this is the question. It used to be that you would have the discussion of the return on investment for investing in well-being, and there have been a lot of really great papers out looking financially at the return on investment for investing in this, trying to estimate that sort of thing. I think given the landscape we're in now, where staffing is short everywhere, where the projected staffing shortage is not just for physicians, but for nursing in particular, is so high. I don't think we are talking about a return on investment anymore in terms of the health of the healthcare workforce. I think now we are entering a situation where we're talking about solvency.
Mm-hmm.
And on top of that, so what I'm saying is we need to be viewing clinician well-being from a lens of investing in the health and sustainability of the workforce. If we don't invest in this, we will lose the sustainability of the workforce, whether through burnout, disability, substance use disorder, what have you. There is a number of off-roads where people can find their way out of the workforce due to overwork, due to unmitigated burnout, due to untreated mental illness, that sort of thing. And so I think we need to take a much broader look at this than just a look at burnout per se.
Mm-hmm.
So my advice would be view this as an investment in the sustainability of the workforce, have that lens, and then find you somebody pragmatic to be your chief wellness officer for your hospital, your institution, whatever size we're talking about here, who can inform the leadership from the lens of well-being. Each person's job, especially in the C-suite, is to look after a certain aspect of the institution, enterprise, hospital, whatever it is we're talking about. And there's aspects of fiscal sustainability, of staffing, of satisfaction, of quality improvement, regulation, that sort of thing, that each person has to really attend to. You have a chief medical officer, you have a chief financial officer, a CEO, those sorts of things. You need somebody who can come at this with only the lens of well-being, who has the privilege of looking at organizational and systematic decisions and act as I view chief wellness officers acting mostly in a role that is sort of like a cabinet member, sort of like an advisor, who can maintain that perspective no matter what's going on with staffing or finances, and then work together with the people who have expertise in those areas to make it work, to make it sustainable. But it definitely is a partnership. It's not well-being of the workforce is not an afterthought. It's not icing. It's not sprinkles, right? It is central. It is bedrock to the sustainability of the healthcare system. And I think we've seen that even clearer through COVID. And I think it's the reason why you're getting so much more traction to talk about things like this and to make changes. You know, that's one side of things, right? That's the sort of carrot side of things. The stick side of things is you got the National Academy of Medicine working with all the major stakeholders, including regulatory bodies, compliance officers, healthcare industry, leaders, pharmaceutical industry, insurance industry, as well as all the professional societies, to come at it from that lens and say, well, what kind of sticks do we need? What kind of regulations do we need to sort of mandate that systems attend to this? At the end of the day, a good balance of carrot and stick is typically what's going to work best. And I think that's what we're going to start seeing. The National Academy is co-chaired by Vivek Murthy, who's the U.S. Surgeon General. So Health and Human Services works hand in hand with the National Academy's collaborative to push forward these sorts of changes. So I think we're going to start seeing those things down the line. It's probably going to take a few years, but that would be my advice.
Mm-hmm. Thank you. It's awesome. And it's awesome to hear that all these groups are working together to kind of address this, or come with something.
It's really inspiring. Yeah, it gives me hope.
What advice can you give to the individuals on maintaining their wellness at an individual level?
Yeah, so I like that you use the word wellness. Wellness is a very individual thing. It's typically one of those words I don't use a lot because I tend to focus on well-being, which is the intersection of wellness with your work environment, with your organizational systemic work environment. In terms of your own well-being, though, I do believe fundamentally that there is an aspect of professional duty owed to our patients to maintain our own well-being to the highest extent possible. So we need to be proactive about this. Let me be clear that I think the bulk of the solution to the burnout crisis, the mental health crisis, all the issues that we're seeing in the healthcare workforce right now is organizational and systemic, but there is an aspect of individual responsibility to be as well as we can be. And sometimes that means hard choices. Sometimes that means changing the way we approach work, learning to say yes and no at the right times, being really mindful about those things, very intentional about those things, being very aware of how we respond in different situations, and being willing to have those hard conversations, whether it be with our coworkers and establishing healthy boundaries, or our bosses. And I tell you, as those who are leaders in healthcare, at whichever level you are a leader, and most of us are leaders at some level, frankly, it's our responsibility to cultivate a culture around us where people establishing those boundaries and intentional acts of well-being, whatever that means for you, and it's very personal, is the norm and it's expected, right? I mean, something as simple as my tag on my email. I do not expect you to answer my email on your day off. Mm-hmm. And I say that recognizing there's all sorts of schedules out there. Mm-hmm. Okay. Wednesday may be your day off. Mm-hmm. Right? Whether you're on vacation or not, or what have you. I don't expect you to answer something on your day off and your time off. Answer this when you get to it. If it's crisis, I'm gonna call you. But establishing that kind of sense that we have our time at work, we have our time away from work, and I'm going to respect your time away from work because I know that makes you whole. And mm-hmm. I want you coming whole to take care of your patients, because that's what your patients ultimately are going to want. Mm-hmm. So my advice is, be intentional about it. and view it as a duty owed to your patients.
Mhm. Thank you. That's really a very interesting perspective. And I think it's hard for people at the individual level to do some of these things because you get so swept up in, oh, I have this deadline, or oh, I'm being
Mhm.
asked by so and so to do this. So it can be challenging, but you're right. It's something that we all owe to ourselves and to our patients if we want to have longevity. And also the and I also think leaders, within our own departments and organizations also need to start taking this into more consideration when they're asking people to do more things. So
That's certainly the most expeditious way to affect change, is for the leaders to lead it.
so thank you. Tell me a little bit more about how you got involved with the ASA and how you got on the committee of physician well-being, and then
Mhm.
ultimately chairing it and now being the representative to the National Academy of Medicine.
I mean, I'm blessed.
Mhm.
I worked hard. I prepared. I did an interesting study in something someone wasn't doing. I presented it, and then I was straight up sponsored and mentored to be involved. Um, and when I was given a shot, I took my shot.
Mhm.
Um, and that was also due for mentorship. I mean, this is, my story in terms of well-being is a story of mentorship and sponsorship. Um, just thinking about it on the surface, was mentored by um, I was mentored by John Mitchell in my department at BI to do this study, and then I presented it at SEA. And Gail Randall, who was heading up the Wellbeing Interest Group um, or advisory group to the Committee on Occupational Health, was in the audience, and she approached me and she, advocated for me to attend their next meeting at the ASA. And I brought it to my mentor at Boston Children's Hospital, Dave Wiesel, who's like, "Hey, when you go there, you should come there with a proposal." And so I did, and so and then the chair of the Occupational Health Committee believed in me, and so Marianne Van, like, helped me get more involved with ASA stuff and on the Occupational Health Committee, and it's a story of good mentorship, me approaching mentorship and seeking out mentorship, me doing the work and preparing, and when I was given a shot, taking it and doing a good job of it. But I was definitely blessed with that those good relationships and those people who, you know, as I did the work, as I showed up for it, they believed in me and helped pave the path. So um, it also was just really good timing that I happened to develop this interest when I did at this time in history.
Mhm. That's awesome. And I'm glad you brought up this whole aspect of mentorship and sponsorship. Um, Going into that a little bit more. How did you find, or how would you suggest others to find mentors? As
Mentorship is a two-way street. It's a proactive thing. It's not something you are spoon-fed. And my advice to people is seek mentorship in every area of your life that you find important. So if teaching is a really important part of your career, seek mentorship for teaching. Find someone you think does a good job teaching. If you struggle with work-life balance, like most of us do, find somebody you think's doing it well and seek their mentorship on that. You shouldn't just have one mentor. You should have a ton of mentors, because we're all multifaceted people and nobody's perfect. The biggest piece of advice I have about mentorship is do not put people on pedestals. I've always said you can only put one person or one thing on a pedestal. All right. And that is ultimately your God, whatever you put on the pedestal. Okay. However, whatever spirituality you come to it, that's your God. Okay. Um, make sure whatever you put on that pedestal is infallible, because otherwise it's going to let you down. So you need to see the fallibility in your mentors just as they see the fallibility in you, and you need to respect that. I if you've ever been in a situation where someone's put you on a pedestal, it's a very uncomfortable situation, and it really gets in the way of good mentorship. And so I think when you put someone on a pedestal, especially as a mentor, it creates this sense of duty to the mentor to do what they're telling you to do. And that's not what the relationship's about. The relationship is taking the advice, applying it to who you are, and helping develop you into more of your vision of what you want to become, not just to become another person, if you will.
Wow, that's awesome. Thank you. I appreciate that. What best advice you have received from a mentor?
Yeah, well, I've received a lot of really good advice from mentors. I would say that my mentor when I was a pediatric resident was dual trained in anesthesia and critical care. I wanted to be a PICU doc at the time, and she convinced me to do additional training in anesthesia to complement my critical care skill set. I ended up falling in love with anesthesia and dropping the critical care side of things, because I really had no idea what an anesthesiologist did when I started my residency in it. So um, she also would tell me, when I'd call her in the middle of the night from the PICU, I'd ask her what to do with the patient. She would say, do the right thing for the patient. And it sounds simple, but it was such a clarifying statement at the time. And it really brings it home that a lot of times you do know what the right thing to do is, and you just want someone to empower you to make that decision. And it reminds you that, like, to believe in yourself a little bit more. I've had another mentor advise me in a big institution, a big academic institution, to she would say to keep one foot in the institution and one foot out of the institution, meaning when you're looking at your academic career, do stuff within the department, be a good citizen within the department, move stuff forward, but also be involved with stuff on the national level through committee work or society work or that sort of thing, and learn how things are done elsewhere, make an impact, on that scale as well. That's been great advice. And then I would say the most pragmatic piece of advice I've ever been given is when you receive an email that creates an emotional response in you, do not answer that email for at least 4 hours, if not the next day. And that has been one of the best pieces of advice I've ever received. I've definitely written a lot of emotional emails back and then deleted them and followed that person's advice. I wish more people would do that.
Yeah, that's actually really important advice. That's really good. As you mentioned, networking has impacted your career as well. What recommendations do you have to creating a network for yourself?
Have integrity about it. When you're creating a network, you're trying to meet up with like-minded individuals who either share a passion or can provide advice or can make other connections down the way, but do so with real curiosity in that person. When I say do it with integrity, I mean don't network for the purpose of networking. Network to get to know these people, and to really form a relationship, whether it's strictly professional relationship or a friendship or what have you. But I guess what I'm saying is don't use people as a network. I find it very off-putting sometimes to have networking receptions, and I would rather them be like community building and that sort of thing. Because for me, one of the biggest benefits of networking that I've experienced, the most gratifying aspects of networking, is when I can connect two people in my network to each other who wouldn't have otherwise met, who have similar interests, and then they can move on and they've improved their career, their life, or whatever aspect they're working on. And I find real joy in that. I see myself as a connector And that's how I've approached the work with the ASA is creating this big network that if someone comes to me and I'm like, and they're interested in something, I'm like, who's really interested in that? This person's really interested in that. You guys should talk. And then they do this really incredible thing. It has nothing to do with me, and I love it. And it's just a lot of fun to see that. So I think, going into networking as a way to improve community, to ultimately improve, our lives, our profession, and the care of our patients is the right attitude to approach it with.
Mm-hmm. Mm-hmm. Right, correct. And also, I think it also, in my view, it also helps with um, wellness, because you are creating a community, and we have joy having these relationships with other people, and we create friendships. So that's how I also see it a little bit.
100%. And the thing is that the more you build on that community, and the stronger that community is. I mean, we know from lots and lots and lots of data sets that the most effective form of support after an adverse event is peer support. So if your community is not strong and people don't have strong bonds with one another, that peer support is not going to come naturally. You're going to have to put a lot of constructs in place, a lot of catch nets in place to make sure that people receive peer support. But if you have a strong community with strong relationships, peer support is going to happen naturally.
Mhm.
Um, and I think that's one of the biggest strengths of a high reliability organization, or a strong, well sustainable organization, is that the relationships within that organization are real and strong.
Mhm. Mhm. That's awesome. Um, I just I just want to go back a little bit on leadership development. And what have you done to develop your leadership skills, whether it's in courses or just by run in and do it? uh,
A little bit of everything. I mean, like I said, I'm blessed to have an area of research that I have a natural curiosity about and I really enjoy. So, I've done a lot of reading, and I've done a lot of, I see someone who's doing an initiative, and I pretty unabashedly will just reach out and email somebody, even one of the big names, and start a conversation. And I've learned a lot doing that. um, even in different fields, I try to bridge silos a lot. People who I used to do a lot with a kind of a high profile wellness person in the family practice sphere, and he and I would meet every month or so, um, and talk about well-being and initiatives and that sort of thing. And I took the Stanford's MD Wellbeing Directors course, which was super high yield. I really enjoyed that. But in general, if I see an opportunity to kind of learn more or gain a new perspective or sort of address a blind spot that I have, I'll take it. But again, a lot of that's because I've been blessed with this natural curiosity about it, and so I'm really interested in it. I'm interested in learning the different perspectives, and hearing how different people are approaching it, and sort of celebrating different people having different strengths. I think one of the things when you have an interest like this that's so broad is maintaining a humility about it, that I'm not going to be the expert on every aspect of well-being, right? I have someone I go to when I have a question about psychological safety. I have someone I go to who I view as real expert in substance use disorder or suicidality, or you know burnout, or what have you. And so maintain a humility about your knowledge, and maintaining that humility is easy because the breadth of literature out there is amazing, um, and big, and wellness and well-being is so tangential to so many areas. There's no way anyone could know everything about it, and the more you learn, the more questions you have. So
mhm, mhm. Well, thank you. This has been a wonderful conversation, and it's been a great learning experience for me. So thank you.
no, it's been wonderful talking to you. Thank you so much for doing this. This is such a great series. I'm just humbled that you asked me to do this.
Oh, no, thank you. I appreciate your being so open and honest and showing your vulnerability. So thank you.
It's my pleasure.